COPD is defined as a disease characterized by the presence of airway obstruction primarily from cigarette smoke. It is progressive and not fully reversible. There are two types of COPD. Emphysema. Emphysema is an abnormal permanent enlargement of air spaces. Chronic bronchitis is a chronic productive cough for 3 months in each of 2 consecutive years. Signs and symptoms of COPD include the signs: wheezing, decreased breath sounds, barrel chest, hypoxemia, a partial pressure less than 60, oxygen saturation less than 88, tripod position, pursed lip breathing, and use of accessory muscles of respiration in the patient. Symptoms: the patient will report cough, shortness of breath, unintended weight loss. In the later stages, lack of energy, feeling of chest tightness, especially following activity. How common is COPD? So, an estimated of 12.1 million adults in the U.S. over age 18 have COPD. COPD is more common in men than women, but the number of women with COPD is increasing due to increased number of women smoking cigarettes. Death rates in women are higher than men from COPD in 2000. In 2009, 52.3% of deaths from COPD were women. Genetics. There is a genetic predisposition that influences the development of COPD, mortality rates, and life expectancy among smokers and non-smokers. In terms of ethnic groups, mortality rates from COPD are higher in white Americans and lower in Hispanics than other ethnic groups. In 2009, nearly 80% of COPD deaths were from non-Hispanic whites. Hispanics had the least number of deaths, with 3,714. This chart will show the trend of COPD in Texas as of 2011, characterized by age groups, race and ethnicity, and sex. Knock, knock. Good morning, Mr. Kovich. How are you today?
You can call me Mr. Gustav.
Okay, Mr. Gustav. May I have your age, please?
I am 64 years old.
Okay. Any significant past medical history that we need to know about?
I've been smoking about for 40 years now.
Okay.
And I had pneumonia quite often as a kid. Last time was around 2009.
Okay. And the cigarette smoking, how many packs a day do you smoke?
I smoke about 2 packs a day.
Okay. Do you drink?
Yes.
Occasionally or often, or what exactly?
Often. Pretty much every day.
Often, every day? Okay. Any allergies?
I'm allergic to sulfur and penicillin.
Okay. I'm going to take a listen to your breath and your heart lung sounds real quick.
Okay.
Take a deep breath for me. Does it hurt to take a deep breath?
It just makes me want to cough more.
Okay. One more time. And now when you're coughing, do you experience any sputum, any like white or pink mucus?
I notice I cough up a little bit. That's right there, so.
Okay, okay. I'll make sure we note that and the doctor knows that as well. I'm going to go ahead and take your pulse off, just to see what your saturation is in your blood. Alright, Mr. Gustav, it looks like you will be needing additional oxygen source at this moment because your pulse oxygen is at 87 right now.
Okay.
So I'm going to go ahead and give you some supplementary oxygen.
Okay.
Okay. Let's see if that helps you breathe any better, okay?
Yeah. Okay. Let's go.
Just want to check if there's any improvement on you right now.
Okay.
All right, well, I'll go speak to the doctor and he will be with you shortly.
Okay.
He or she will be with you shortly.
Thank you.
Thank you.
Thank you.
So, how does the doctor know if I have COPD? The doctor will first take a thorough history and physical to determine if your signs and symptoms match a diagnosis of COPD. Then he will perform a number of diagnostic tests. Many of these tests are quick and painless. The most common test is called spirometry. This is done to measure the function of your lungs. Spirometry uses a device called a spirometer, which measures how much air you can breathe in and how much air you can breathe out. Also, it will measure how fast you can breathe that air out. Spirometry values that are below average, which is below 1500, indicates that your lungs aren't working as well as they should. If you have already been diagnosed with COPD, spirometry may be used periodically to check how well your medications are working and whether your symptoms are under control. You should follow your doctor's instructions about whether you should avoid the use of inhaled breathing medications or other medications before the exam. Other steps to take include: first, wear loose clothing that won't interfere with your ability to take a deep breath. Also, you should avoid eating a large meal before the test so it will be easier to breathe. Other diagnostic tests include lab values. This test will require blood to be drawn. Another test is a 6-minute walk test. This test is used to determine the amount of oxygen in your blood after mild exercise such as walking. Normally in COPD patients with exercise, the amount of O2 decreases. This is not a normal finding. This test is also quick and painless. The next test, a sputum culture. This is a sample of mucus that you may have been coughing up. The doctor will test it for a number of things. However, this is only done if you are hospitalized with an acute exacerbation and may not have responded to antibiotics. Primarily, all of these tests are done to allow the doctor to determine the severity and impact of the disease that it has taken on your life. Okay, well, how are you? I know you just got this new diagnosis. How are you feeling about it?
Just wondering how this could happen.
How this could happen? Okay, so you just want to know why this disease happened to you.
Yes.
Okay, well, there's actually a couple of risk factors that puts you more susceptible to getting this disease. So first of all, let's talk about your smoking. How often do you smoke?
About 2 packs a day.
2 packs a day. Okay, and how long have you been smoking 2 packs a day?
Around 40 years.
40 years. Okay, so smoking is one of the #1 risk factors for the development of COPD. Okay? So because of your extensive history in smoking, that could have been one of the major contributors to you developing this. And then also, where do you work at?
I work at iron factory.
Iron factory, yes. So an additional risk factor is occupational chemical dust. So working in an iron factory, it has a lot of pollution in the air. And if you've been working there for?
Since I was young.
Okay.
Right straight out of school, I went straight to work.
Okay, so it's fair to say about 40, 50 years?
Just about.
So you breathing in those hazardous toxins every day that could lead to the inflammation and obstructive airways. So also infection, you also have a history of recurrent respiratory infection where you got pneumonia quite a lot when you were a child, is that correct?
Yes, yes.
So that's another reason why that you could have gotten this disease. And then other ones, it could be genetics, as if your father or your mother or someone in your family have gotten this. Also aging, you are 64, correct?
Yes.
Okay, because you're 64, what happens when you get older, your lungs become smaller and rounder, and it gradually loses its ability to expand. Okay, now do you understand a little bit more as to why you have developed this?
Yes, yes,
Okay.
yes I do now.
Okay, I know this is very unfortunate. Do you have any other questions that I may assist you with?
No questions at the moment.
No more questions? Okay, I'm going to leave you in here to rest for a while, okay?
Thank you.
Okay.
COPD may affect other aspects of health. For example, it can cause cardiovascular problems. The blood vessels in the lung become smaller, causing what is called pulmonary hypertension. This can later on lead to heart failure, causing more symptoms in the patient, such as weakness and swelling in the legs and feet. It can also cause sleeplessness and loss of appetite, since the patient is having such a hard time breathing. This difficulty breathing can also cause anxiety in the patient.
Excuse me, Mr. Gustav. How are you doing?
Okay.
Better? Okay. My name is Vanessa. I'm going to be one of the other nurses working with you. And the doctor asked me if I could come in and talk to you a little bit more about the treatment plan. And first of all, I want to talk to you about your medication. You're going to be getting a bronchodilator, which is going to help open up the airways a little bit more so you can breathe easier. You know, air can pass through your bronchi or your airway easier. And then also in corticosteroid, which is going to help with the inflammation. These medications, we're going to have to take them however the doctor says. Usually it's in the morning and at night, but if the doctor believes that you need it more often, then we might adjust. It's very important that you take your medications as the doctor says. It has been proven that it reduces the emergency department visits. So, you know, we're going to talk about your medication plan once the doctor puts in the order. Also, have you been having any problem with your appetite? Like, have you lost any weight or anything?
Past month I lost around 10 pounds.
Oh, wow. Okay, so we're going to have to also work on your diet. Mainly, just small frequent meals is going to help. So, you know, when you get tired eating, it's okay. But we can do it often. We can do the meals often instead of just 3 meals in one day, 3 big meals. And also, with the oxygen, it's mainly with periods of exacerbation. Like right now, your oxygen it was low, so you needed it. But you know, it's not going to be a permanent thing. And what's going to help a lot with that also is going to be quit smoking. Because if you know, smoking is just going to make it worse. So we have to work on you quitting smoking. And if you need any help, we can refer you to different programs that might help you also quit smoking. That's going to be our number one goal for now. Okay? And we're going to continue working with you. Do you have any questions?
Not right now, thank you.
Hi, Mr. Gustav. My name is Pam. I'm your case manager. How are you feeling?
Better.
Better? Do you breathe better after the medication kick in?
It has helped, yes.
Okay. So I knew that you have COPD. How do you feel about that?
It's unfortunate. They explained to me why, but I guess this is the way it is now.
Okay. Are you working right now?
Yes, still working. 1 more year to retire.
Okay. What is your plan in the future after you get home?
Probably head back to work.
Okay. And I know that you are smoking. You have been smoking for 40 years?
Yes, ma'am, 40 years.
Do you have any plan to quit?
I know they say important, but I've been smoking for so long.
Okay. Here at the hospital, we have the smoking cessation. Do you want to join us?
When do I go now?
No, not right now. You don't have too much strength to go, right? Okay. The class, it's just like a group support. It helps you to quit smoking, and we have really flexible schedule every day. Do you want me to refer you?
Will this take time away from work?
Do you work at the weekend?
No, I don't.
No? Okay, so we have the cessation like during the weekend too. It's only like an hour for one meeting. Do you think you can do that?
I think I can do it.
Okay, that's good. Do you have any spiritual belief, Miss Gustav?
I go to Eastern Orthodox Church. Now, probably about 3 miles from the hospital.
Okay. Do you need someone to come and talk to you about your belief?
Not right.
The primary goal for a COPD patient is to restore the highest possible level of independent function. These goals are achieved through patient and family education, exercise training, psychosocial and behavioral interventions such as smoking cessation. So why do COPD patients need emotional support? It's because the patient's functional level decreases dramatically and it is really costly to manage the disease. COPD patients have higher risk for psychological problems such as depression. Where can a patient with COPD can find emotional support is from her family, friends, coworkers, and healthcare teams, such as asking for help with chores and errands. Join a COPD support group with family members. American Lung Association is the best resource for COPD patients. It provides disease treatment, smoking cessation, and specially helping hands, which is the service that provides meals for the family, rides to medical appointments and visits. The patients can also find out about information of financial and legal documents